I'm Greg, and you're listening to Totally Preventable.
Totally preventable.
Totally preventable.
Totally preventable. Totally preventable.
Totally preventable.
Totally preventable.
Hey, Polly, how you doing?
Good, Greg. How are you?
I'm okay. We have some experts on it with us today.
You and me?
Yeah, exactly.
Yeah.
We are the experts. But we have Tom Chardonnay and Brian Volpe from the Opioid Response Strategy of Rhode Island. So
they must be busy.
Unfortunately, I believe they are.
Yeah.
So they're going to give us some information on this opioid crisis and epidemic that we're seeing all throughout the country.
Yeah. Okay. Well, not a uplifting topic, but very important.
Very true.
Yeah.
Without further ado, today joining us on the Totally Preventable podcast, we have Tom Chardonnay and Brian Volpe, both from the Rhode Island ORS program. Thank you very much for joining us. How are you doing today?
Great, thank you.
Hey, good morning, Craig. Yeah, great. Thank you. It's nice to be here.
Thank you.
So could you guys tell us a little bit about yourselves and what you do at the ORS?
Sure. My name is Tom Chardonnay. I am the public health analyst for the Overdose Response Strategy program for Rhode Island. I work mostly in the public health sector, trying to make connections, build relationships, share information. We'll get more into what we do, but that's pretty much what I do. And I came to this job. I had a prior military background and worked a lot with helping local communities when I was deployed and working with law enforcement when I was here in Rhode Island. So that's my story.
Yes, my name is Brian Volpe. I'm the Drug Intelligence Officer for the state of Rhode Island, working with the New England High Intensity Drug Trafficking Area, big acronym. We call it the HIDA, New England HIDA. Much like Tom, I work with the public safety sector. Tom works with the public health sector. And what we try to do is marry them together as far as sharing information, getting people into the same room, speak the same language, and come to terms, maybe work together on some effective strategies to combat the opioid crisis and the overdose crisis. Tom and I started this job at the same time 7 years ago. I think we're the oldest team in the overdose response strategy, the ORS. And prior to that, I had 25 years of law enforcement service in the state of Rhode Island with the Coventry Police Department, where I started off as a patrolman back in 1990 and retired out of there as chief of police in 2015. Right after that, I started this job, and it was fantastic. And we've really enjoyed working together and trying to make a difference with the overdose issue here in Rhode Island. We have some great collaborators in the state, some great partners, and some who we've already spoken to today. So we do think we make a difference, and we're certainly out here trying to do so every day. And thank you very much to having us here today, because it's nice to get our message out, because we're usually speaking with persons that we can't generally give information to the public. So here, you taking the time to help us vet some of the questions that we can actually speak to and put out a message is great for us as well. So thank you.
Wow, our pleasure. We got experts on the line here, so
Right.
that's good.
Right.
That's good. We know we're getting trusted information. So you did mention HIDA and the opioid response strategy. Can you tell us a little bit more about that?
I'll tackle the HIDA part.
Sure.
So the HIDA is High Intensity Drug Trafficking Area. It's a program that is funded by the Office of National Drug Control Policy, which is a cabinet position up near the president. So they fund the HIDA programs. Each state applies for a HIDA region. It's almost like a membership, because they feel that certain parts of the state have drug problems, drug trafficking issues, and the funding that the ONDCP gives to the HIDA, if they realize and receive that HIDA designation as a HIDA area, it funds overtime, it funds programs for law enforcement to combat the drug issue in certain areas of any given state. And Rhode Island is one. It's the Providence, HIDA area. So we work within that.
Sure. And so I work for this, the CDC Foundation, that they fund my position for the ORS. And the ORS, the mission of the ORS is to help communities reduce fatal and non-fatal overdoses by connecting public health and public safety agencies, sharing information, and supporting evidence-based strategies and interventions. While the goal is specific, the methods of achieving this outcome are broadly defined. So every state, every team operates in a different way, and the way we operate here in Rhode Island is different from how they do it in Massachusetts or in Florida or Texas, anywhere else. So we've found our rhythm and how we work here in Rhode Island, and it works out well.
That's good.
And so I'm assuming from everything I've read and I've been following, but we have a pretty significant overdose issue here in Rhode Island, correct?
Correct.
You both have your Narcan on you?
I don't.
Not here.
I
I
don't.
have it in the car. It's in
In this car.
my backpack that I take to and from the car. So I have it in both places, but not on me here.
So I often hear, we teach Narcan here. We give out
Right.
Narcan kits. We all carry it, right, Craig?
That's right.
Okay. And
Great.
we often hear like, oh, we don't hear a lot about overdoses in Rhode Island. Can you give us a little more information about how prevalent it is in Rhode Island?
Sure. Well, the overdose issue here in Rhode Island is pretty significant. Last year, 435 Rhode Islanders lost their lives to overdose. And, it is totally preventable, especially with the amount of Narcan and prevention and information that's available in the state. And it's a great outreach, treatment, and recovery. It's 100% preventable, but unfortunately, we do have a high fatal overdose number. And 2022 numbers were just put out, I think a couple of weeks ago, and it's only one less from 2021. It's at 434, so it is pretty prevalent.
Yeah, I mean, when we talk about overdoses, we usually focus on the overdose deaths, but there are quite a few non-fatal overdoses that occur every week within the state, and they are monitored by Rhode Island Department of Health by looking at 48-hour data. That's data that goes into the hospitals. A person goes into a hospital with overdose or suspected overdose, the hospitals are required to report to the Department of Health within 48 hours. They do a really good job at doing so. And that data is also supported by the emergency medical service runs, like rescue runs.
Mhm.
And they marry the two datas together and have a pretty good sight picture as to how many non-fatal overdoses happen within the state in a given week. And that's monitored weekly. And that number is significant. There's one of the issues that we deal with and why we don't put out a lot of information, especially at the state level, about overdose numbers, which can be a little tricky because they're 42 CFR, HIPAA, small numbers policy within the state of Rhode Island Department of Health. They don't want to give out any identifying information. We understand that. We like to protect everyone's information. But there's some very interesting overdose information right on the Rhode Island Department of Health's website, which can give you updated numbers. And that's health.ri.org. And there's some fantastic information that we refer to quite a bit. And sometimes we can make a phone call too, which helps. But,
Yeah, the Pori website
yeah,
also.
I know what those are, right?
So, another great website to check out.
Great information and also great resources for persons that want to learn more about overdose, addiction, and other issues within that world. All great resources that we tapped into quite a bit.
Now, nowadays, you can't talk overdose without talking fentanyl. And I was one who thought that fentanyl was just, it was just one thing. But And are there different types of fentanyl? And can you explain?
Sure. There are lots of fentanyl, and it's found in different forms. You find it in pill and powdered form. But the different analogs, a few years ago, they were being found more often in our state lab. Some of those analogs included carfentanil, FIBF, fentanyl. There's probably about 7 or 8 different fentanyls. Now, right now, mostly they're finding parafluorofentanyl, acetyl fentanyl, but mostly just regular or just fentanyl. For the most part, it's just fentanyl. You see these 2 others, parafluoral and acetyl fentanyl, and variable throughout the months that we were looking at. So it is found in different items. People have reported finding it in cocaine. People have reported finding it in other drugs. But we mainly see it pill powder form.
All right.
We try to push out a lot of information for parents and young people about counterfeit pills. What are the numbers looking like in Rhode Island for counterfeit pills?
Are you looking for like numbers of seized pills, like the amounts?
Yeah, that would be great if you know.
I'm sorry, but I can't give you that number because they don't really count them.
Okay,
What we can tell you is the counterfeit fentanyl pills that we see through the lab and through our partners in local, state, and federal law enforcement, tens of thousands of counterfeit Percocets, the Perc 30s, the M30s. They're small blue pills, very closely resemble actual RX pills that you would get from the pharmacy. To a point where when we started looking at the pills back in probably 2017, the quality of the pills were not that good. They were very dusty, they'd fall apart, they'd break up. The ones that we see now in bags of what, 10,000?
10,000.
That are being sold and seized in Rhode Island, they're very good quality. I can't tell the difference, the lab can, but they're probably one of the biggest issues we have out there as far as amounts and seizures, large seizure amounts.
Yeah, counterfeit pills, probably one of the biggest issues right now today. And it's not just fentanyl pills, it's all pills. So we're talking about the benzodiazepines. There's probably 10 different variations that are found on the street, and the fentanyl pills, or the opioid pills, like Brian was just talking about. And then there's the methamphetamine, or the pills with methamphetamine. They look like ADHD drugs, Adderall. Anything anyone's buying on the streets, if you're not getting it from a drugstore, you have to assume that it's either got it's clandestinely made, and it's either got fentanyl, meth, or some kind of tranquilizer. It's dangerous, or it could have all these. I guess you have to assume it could have fentanyl. It's just extremely dangerous, unreliable, and if you're not getting them from a drugstore, that's what you get.
right.
Yeah, just for kind of scope. It wasn't that long ago where the counterfeit Adderall pills, the AD 30 pills, really good quality pills that they're making right now. I believe there was 600,000 of them seized in the northern part of the state in one residence. So that speaks to the amounts of pills, and probably may even the amount of the problem, because those, a lot of kids use those pills.
Right.
There's specific concern with some of the colleges, places of higher learning, that the kids may use these in replacement for Adderall pills, because Adderall was in short supply, especially during the times when they're studying. So we monitor, Tom and I monitor those with the Rhode Island Forensic Drug Chemistry Lab, who does all the testing. Keep a close eye on not so much amounts, but the types of different compounds that are being found in the pills. And Tom does a lot of work extensively with that, trying to correlate what's coming in, so we can be aware of the trends that we see here in Rhode Island, but we can also speak to our partners in outreach at Rhode Island Department of Health, and just about everybody across the board, behavioral health, just as to what we see And then in turn, we marry it together with the information that they see in the field and kind of come to some good conclusions with that. It's not a perfect science, but it works pretty well.
Now, we have some great discussions with our outreach partners in treatment, recovery, and just to try and get the information out. And it's a great back and forth, and sometimes we check with the lab back and forth. But the dosage amounts in these pills are extremely unreliable. Many of them have fatal amounts if they're for someone who's not used to it, or for someone who takes two. Very, very dangerous pills.
Speak to the whole the dosage in the fentanyl pills, how that's changed.
Sure.
It's very interesting. It's very poignant for Rhode Island right now.
Back in 2019, DEA did some research looking at dosage amounts in counterfeit opioid pills, the A215s, M30s, stuff like that. And what they were finding was they're about 1.5 milligrams. And as they went along every year, they did more testing. And now it's up to about 2 milligrams of fentanyl per pill is what they're seeing as the average. And 2 milligrams is what they see as a fatal dose. Now, a fatal dose, and this gets into maybe some more information further on how a dose is taken, whether it's ingested orally or injected, but 2 milligrams is considered a fatal dose. So ingested orally, who knows if that's a fatal dose, but it's extremely powerful. And if someone crushes and snorts, it's extremely dangerous either way. So yeah, they're unreliable, they're very dangerous, and they're, as Brian was talking about, they're available.
Very
large
available.
amounts.
Is it,
Cheap.
yeah,
Very
is
cheap.
it, did I hear it 6 out of 10 pills have a fatal, of counterfeit pills have a fatal dose of fentanyl?
Well, I'm not sure about that statistic, but many have that 2 milligram. That's the average right now, 2 milligrams. It's extremely dangerous. Someone taking it orally, it's just because it doesn't produce a fatal overdose doesn't mean someone's not going to overdose. So you can still overdose, but not fatally, at least, easily. And if they're crushed and snorted, they're extremely dangerous because it's a different uptake of bioavailability.
And one of the big problems is if a person that regularly uses these pills, they have a tolerance for a 2 milligram pill. A person who doesn't normally take these types of pills, maybe a casual cocaine user, a Friday night powdered cocaine user, say, hey, try one of these pills. That person's going to have a very big issue quickly with the 2 milligram pill because they have no tolerance. And that's, I think we're seeing some intersection there. We've seen that for a number of years.
Yeah, they might take a little time for the active ingredient to onset. So in that time, someone might think, it's really not that bad, and have a few drinks or take something else, and then you have a poly drug overdose. Just dangerous situations across the board. But that's our information for the pill situation.
I particularly worry with the fentanyl being in Adderall because people who don't even think they're taking an opioid, like, so you're like, oh, it's just an Adderall. It's not I'm not taking opioids, could end up.
I don't think we've actually seen Adderall with fentanyl.
Oh, no.
Methamphetamine. Sorry, we should have clarified that.
Okay.
The Adderall pills that we have seen, and especially the big numbers of them,
Yep.
Instead of the active ingredient in Adderall, they replace that with methamphetamine, which is quite a stimulant.
Yeah.
Sorry, we should have clarified that before. But yeah, that's another one of the counterfeit pills that is roaming around the state.
Right.
Some problems, but yeah, that's methamphetamine, the AD30 Adderall pills, counterfeit. Yep.
And people should always test their drugs anyways,
Yes.
because a lot of these things are going through the same hands and the same bag, and there's contamination. So it's dangerous situations. I'm sorry, go ahead.
Yeah,
No, it's okay.
that kind of just leads into my next question. Is it only fentanyl that's being found in these counterfeit pills?
No, Greg, it's methamphetamine.
Well,
too.
thank you. Are there other substances that we should be alerted to, or trends that are happening?
I think we could talk to, there's been a lot of information online in the news about xylazine. And xylazine is very prevalent here in Rhode Island. It's usually mixed with fentanyl, powdered fentanyl. We've seen it in pill form. We've seen it in powder form. But I think the numbers are, Tom, I know you have the numbers on that.
It's about a third of all
Yeah.
fentanyl, powder fentanyl that we see has xylazine mixed into it. And when we look at pills, in pill form, there's about 40% of opioid pills have xylazine in them.
Yeah. And this isn't new. I mean, xylazine is new in the news over the past few months, but we've seen it here in Rhode Island for a while, and that's been told to us from our friends at the lab. And one of the, I wouldn't call it an issue, the lab just didn't track it because it wasn't a scheduled drug. It wasn't really illegal. But once we started working with the Rhode Island Department of Health, we were fortunate to have some traction with the problem that xylazine could cause if it was so much in the drug stream here in Rhode Island, that Rhode Island made the preemptive strike and did schedule it. So now we can track it. So since 2020, we have been tracking, and it's pretty astonishing how much is actually out there. You know,
That's crazy. It wouldn't be considered illegal. Like what we know about it now, like, you know.
it's a veterinary drug.
Yeah.
Not for human use. Yeah, it's more for
Right.
horses and animals, not for us. But
Yeah. When
people will,
start abusing it, then yeah.
strong sedative. Yeah.
Could you explain to us why consuming pills or any kind of drug your body can react differently if you take it orally or snort it or inject it?
Sure. And it's probably more of a question for a pharmacist or a doctor, but what we know about some of this is the bioavailability. So bioavailability being what part gets processed by the brain or how much gets processed by the brain. And when someone's injecting a drug, I believe 100% of that goes to the brain. But when someone's taking a drug orally, some gets diminished in the digestion process, and some end up being going to the brain and being used. But the uptake or the bioavailability that's the best or the most is through injection or inhalation. So smoking or snorting, that makes there's more bioavailability there. So people will have a stronger reaction to a drug when they inject it or they snort it. And that's why these pills are extremely dangerous, because there's the high dose in those pills. And if someone was to inject that, it becomes extremely dangerous, or even snort it, very dangerous.
I think one of the biggest things that I always get is when we're talking about this, and you were saying 2 milligrams are in the pill, that's an average. So there's going to be pills that have far more. And that's
Right. So there's outliers.
Right.
They found them with I think it was 0.4.
Yeah.
0.5, like 2 and 4 times the fatal dose. And there's no regulation of these. People make them in their basement sometimes, or they're coming from across the border. There's just no regulation. It's very unreliable, very dangerous.
with the risk. I don't see how, the dealer can find this as a profitable thing, with the risk of losing your clientele from overdose. Is the use of fentanyl, is that a profitable thing, or?
In pill form and in powder form, it's shown that it has been. We have to look at fentanyl was a replacement for heroin, and heroin takes a lot of manpower, a lot of man hours to grow, to cultivate, to process, to ship, and everything to get over the border or bring it into this country from where it was coming from. That man hours, manpower, transportation all cost money. Fentanyl, you don't need a lot for an effective dose. Like they say, a little goes a long way. So just for instance, we talk about Tom and I talk about fentanyl pills and like the margin of profit on, say, 1 kilo. I mean, it's a hypothetical. So you buy $50,000 kilo of fentanyl. you could probably make somewhere around 500,000 fentanyl pills, counterfeit pills from that. So $50,000 outlay, 500,000 pills at say $10 a pop. That's pretty good return on your investment. So from what we know, I mean, we're not talking about pure fentanyl coming in at 90% purity from China. It could be far less pure fentanyl coming over the border from Mexico. They're still going to make pills from that here, or the super labs down in Mexico are going to create their own, which we do see. See large amounts of pills coming over the border that are being seized to the tune of 500,000, 600,000, 300,000 counterfeit pills. That's relatively common at the southwest border, and that does translate into sometimes what we see up here in the Northeast, because they do travel. The cartels are invested here because there's a market, and the pills are pretty hot commodity. So I kind of jumped all over that.
No,
Yeah.
Happens here too. Don't worry.
Talk all day on this.
Could you walk us through what a seizure might look like?
Okay, I mean, we have to look at it in different stages. Look at like a local police department, state police department, the federal police department. If we can start in big. At the southwest border, point of entry, one of the border crossings. A lot of Customs and Border Protection agents there. They have high-tech equipment, X-ray machines, trailer trucks, you name it. They find upwards, and just say in a 1 week period, or a week and a half, this is some of the seizures that they had. 72 pounds of fentanyl in one vehicle, 661,000 fentanyl pills, one vehicle, 695,000 fentanyl pills, one vehicle, 7 kilograms of powdered fentanyl, one vehicle. That's a 1 week period. And that's only one border crossing, there's several. So, and that's just the ones they're catching,
Right.
the ones that are getting through. And that's why we try to focus on, okay, can you quantify the amount that's coming in? It's almost like insurmountable because it comes in from various ways. I mean, it comes into the United States Postal Service. That'll be mailed because they can't check every package. And,
I feel like they like totally rake me over the coals when I'm sending a package to one of my kids in college. I mean, what? They want to know if I have any fruit. I don't know.
I mean, but they're not sending large amounts. You know, they're sending, you know, a kilogram or a couple of kilograms. You know, that not sending tons.
Right.
So, but the movement and the market's here, and the product is coming. So then we look at like the state. A lot of the local, state, and federal law enforcement task forces, they work together in concert to combat the problem. So they'll see seizures anywhere from an ounce of a certain product up to maybe 300,000 pills. But what we've been hearing and speaking with a lot of our partners is they used to get ounces of cocaine, maybe an ounce of fentanyl, an ounce of methamphetamine, crystal meth. Now it's all kilos. So kilo is the new ounce. So that says a lot to the supply that's out there. So there's a lot of supply in the street in Rhode Island, especially in pills and just about everything across the board. And that doesn't even scrape the surface of what we don't know. We only see what we've seized. We don't know what else is out there. You know, so it's tricky. But it could be anywhere from 10 grams and up is a felony charge.
Wow.
10 grams or more. And that will be tested at the lab. And the person will be charged with a felony. Everything else is a misdemeanor under 10 grams. Those aren't generally tested as much.
And one of the changes, and I think Brian covered this, all right. One of the changes we've seen is that a lot of the seizures are polydrug seizures.
Yes.
There used to be one, like a dealer who was, whether it was cocaine, marijuana, opioid. Now everything seems to be poly, and it appeals, I guess, to.
Yeah, one-stop shopping.
Yeah.
Maybe that's that's we've seen that change over, no longer see just a heroin dealer. You see the guy sells fentanyl, cocaine, meth, you name it, across the board. So let's face it, they're all in it for profit.
Right.
Yeah.
Right. What would you say the community needs to be most aware of?
We talk about this, we mull this over quite a bit. I know we can give you like a long-winded answer.
Whatever you like. We want to make sure that
The answer. And Tom says it the best, especially when it comes to the counterfeits.
Well, pills. I think pill use, because it's so normalized, and I don't mean that in a general sense. I mean, everyone's growing up taking pills. I mean, aspirin, whatever it is. And when they're so available on the streets, so cheap and so powerful, it's danger to our younger community. Just might not know. It's a danger, to those who are trying for the first time or someone who's just injured. Oftentimes people without our community members who aren't insured, if they're in pain and they really need to manage their pain to go to work or to continue what they're doing, they might seek these out. A friend might give them one, and one pill can kill, as we know. It's totally preventable. It's not something, it is totally preventable.
We like to basically say that if you're going to buy a pill or any powder on the street, especially but focus on pills, assume that it's counterfeit and it's dangerous, because the diversion of pharmaceutical pills, there's not that much of that anymore. There used to be, where people would sell, grandmother's Percocets.
Right.
Now they're just consider them all counterfeit, and you're rolling the dice if you're going to take one. And we both know our partners at Rhode Island Department of Health. They have some great messaging that they put out to the public in terms of be careful. But I just wish more people would take heed of that, because the numbers are still very high as far as overdoses and the overdose deaths. But one pill can kill, and assume that everything that you take, especially in a pill that you buy from the street or get from somebody else, maybe a freebie, is probably going to be counterfeit and deadly or dangerous.
Scary stuff.
Very scary. This is wild. I think if I've taken a lot of information from this interview, I think the kilo is the new ounce.
Yeah.
is just going to stick with me for, that's just wild. So I want to thank you both for taking the time to talk to us and enlighten us on the great work that you're doing. I'm happy that when I think about how scary this is, that we have two representatives out there looking out for the community such as yourselves. So thank you very much.
If you ever need any prevention help, let us know. Or if you've got some great tips for us, we're always looking for them.
That's great. And we're here as a resource for you. We thank you and the Totally Preventable podcast for having us on. It's just to get our message across with people that understand what we're dealing with, and someone we can share information that could be impactful, especially down your way. We try to do it quite a bit.
Thank you.
Thank you both very much.
Much.
A pleasure.
Have a great day.
You too.
All
Thank
right,
you.
Thanks.
I'm Polly, and you've just listened to Totally Preventable.
Totally preventable. Totally preventable.
Totally Preventable.